Assalamu alaikum. Good day to everyone who is watching my presentation. My name is Muhammad Arif Ramadan and I am a business student from University of Hull, Faculty of Business. I would like to present about mitigating the impacts of a global pandemic on health, hygiene, and home goods. Without further ado, let us continue to the topic. Introduction. It is the recurring issue of the topic that the growing demand for medical, hygiene, and household goods during a global pandemic. The healthcare and retail industries are at the risk of collapsing as a result of excessive demand pressure, which is compounded by a lack of effective solutions and inconsistency in monetary and fiscal policies. That is just one of the many ramifications of panic buying during a national or global disaster such as the coronavirus pandemic, which has been documented. Perhaps most concerning, it may disproportionately affect the most vulnerable members of society. Recognizing supply chain management trends and experiences in the industry will assist in the development of a final concept. With the COVID-19 pandemic, it is relatively simple to identify the flaws. It all starts with early decisions made by the government. Whatever they choose will have a cause and effect relationship that will either escalate or de-escalate the situation, depending on the circumstances. As shown in the graph, after a year of being exposed to the pandemic, the response rates of the Indonesian and United Kingdom governments become more active. So what are the goods? So the commodities that help the people avoid and prevent the worst possible outcome that could inflict short and long-term damage to themselves, the others, or the economy as a whole, are to be kept in check during these dire times. These said commodities are personal protective equipment, also known as PPE, which are inclusive of surgical masks, N95 masks, gloves, hazmat suits, and face shields. Outside of that, we have hand sanitizers, antiviral drugs, vitamin supplements, and diagnostic tools, which are also being shared with frontline workers and not just the civilians. So, problem identification. So, let us focus on the cause and consequences of the situation. The media initially exaggerated the pandemic because it was a new virus that might change and spread easily. There was a panic for months as people across the country hoarded sanitary items and medical supplies. Stores ran out of supplies as supplies fell uncontrollably below demand. And also, supplies couldn't keep up and had to outsource to nations where supply is stable there. And in Indonesia, for example, we have mask prices being quadrupled and wholesalers tripling the ventilator prices as well because the supply of these goods were going down. On the other hand, vice on the contrary, we have the demand going upwards. And because of the outbreak disrupting the international trade and transportation, meeting the tremendous demand for those medical supplies and equipment required outsourcing. So, due to the newly additional stages or newly added protocols and requirements uh, to get these products from overseas by using outsourcing, several vital operations had to be halted because it was just too many for the government to handle while they're also taking care of the situation in their own country. So there's also a potential of fraud, as we have an example of where China shipping incorrect medical supplies and test kits. Therefore, the Netherlands, Spain, Turkey, Georgia, and the Czech Republic have all rejected these products because they were rendered as useless. My objectives is that of my research is to figure out ways on how to avoid and prevent such disruptions from happening and to learn the patterns of the spread of the virus in businesses, starting from external and towards internal factors. And we have the widespread panic and its effects towards the supply, which is one of the major causes of these supply deficits. So To talk about it, a growing number of healthcare providers and citizens are expressing concern about the shortage of medical supplies as a result of widespread concern. To alleviate the psychological effects of a global catastrophe, it is necessary for one person to be patient for an extended period of time. So this one person stays patient, and so the others could stay patient as well. If not, it could act as a domino effect where one person could affect everyone else in the community. This includes issues such as basics, for example, lack of toilet paper, to a more serious matter such as the lack of respiratory machines to treat infected patients who are in need of treatment. In addition to that, it is more harmful than spreading unfounded fear through physical or digital means. This, what I mean, is by that unfounded fear is the spread of these rumors regarding COVID-19. And therefore, they made a research into this misinformation by aiming to understand how and when false theories emerge in context of public health emergencies. Coronavirus media coverage is currently in the early stages of development and is unstudied, but as of now, it's being studied and is in the mid-range to high stages of development. Despite this, an examination of two previous epidemics that occurred around the same time as recent news about COVID-19 demonstrates that the difficulty in dispelling health-related rumors were deemed to be quite difficult. People in hospitals buying in a frenzy manner has hampered the ability of the PPE supply chain to keep up with rising demand, according to the report in the slide. And so, therefore, a lot of the surgical masks, respirators, and gowns that were used by the frontline workers, their costs have increased drastically, according to WHO's report back in 2020. Currently, the demand is 4 to 6 months behind the schedule of these items. Therefore, many governments have prohibited the exportation or the export of these goods to overseas. And next, we have a graph that illustrates the relationship between various factors and availability of personal protective equipment in healthcare, the PPE. Basing on the theories that I found, which are four of them. First of all, we have the social political views on crisis. It is concerned with cultural symbols and living philosophies in the context of crisis social political philosophy. This is when collectively formed relationships lose their sense of purpose, legitimacy, and institutionalization. They are said to be in a crisis. The strategies of emerging economies in response to the pandemic will fall short of those of developed economies. Next, we have the domino effect and the appearance of disruptions by third parties. I've already mentioned that before. As a result of the shortage of inventory at many major manufacturers, the severity of the situation is escalating in the midst of the pandemic. Air cargo terminals in countries where COVID-19 is rising are busier than they normally should be. Next, we have the crisis management. As a result of the shortage of inventory at many major manufacturers, the severity of the situation is escalating. No, actually, crisis management, cut that. Crisis management, coordination, teamwork, networking, and the exchange of knowledge are all necessary. These activities can be carried out in one of three ways. Through one, surveillance, second, knowledge exchange, and lastly, we could use both of them as a hybrid. The manner in which crises are approached and managed is influenced by both political and organizational factors. The ultimate goal is to raise awareness of the COVID-19 outbreak among the general public. The international, federal, state, and local responses to COVID-19 will be bolstered by coordinated responses at the international to local levels, respectively. Lastly, is we have the performance, intelligence, and governance of the supply of PPE. Member States should establish a single point of contact for all issues relating to personal protective equipment and medical devices to prevent any confusion. Businesses should concentrate their efforts on the production of life-saving medical equipment in order to avoid shortages or delays. The idea of Rescue EU, made by the EU, stockpiling originate with the European Commission. Prior to epidemics or pandemics, the effectiveness of government health program should be assessed. Governments and private sector stakeholders require a reliable, low-burden information exchange and a supply system. It is possible to improve the supply chain stability by implementing certain internal and external policies done by the government or, impl- or introduced by the companies. So here we have the collection of data that I have. I'm using thematic data analysis. So this method of analysis is effective because it allows me to identify the variables that the interviewee, here we have, has mentioned throughout the interview. Similarities with the literature review as well, that included the high demand for PPE and its rising cost. Here we have discussion and data analysis. The results. The result is that hospitals have been determined to have suffered a lot of costs as well. And these costs are mostly on the PPE and and getting the available sources as well. This has also contributed to a decrease in the number of visitors to the hospital's facilities, resulting in a decrease in the hospital's income as well as the number of visitors. Moving on to the discussion. The findings suggest that there are direct connections between all the different themes that were investigated during the thematic analysis process, internal policies, and the stability of the supply chain and the company's relationship with its suppliers are all examples of what the company must consider. Lastly, the conclusion. Let's conclude. However, it is unclear what is happening in the other countries that were supposed to be involved in the data collection process because of the limitations with the COVID-19 restrictions. So it also lacks information on how a government can assist in the development of policies that would benefit healthcare institutions, owing to the interviewee's lack of knowledge about its external policies and the lack of data from other sources that do not require translation, among other things, in part because the primary data source consists of only one participant. The data is highly generalized to the company as well as the individual who was interviewed. Because of this, it is reasonable to expect some data to be unrelated to previous studies that were examined in the literature review section. According to recent research, there is a strong relationship between social behaviors and the supply and demand of essential goods and services. Last but not least, healthcare organizations should place a high priority on the safety of the employees and patients rather than the safety of the devices and equipment they purchase. Thank you very much for listening, and I bid you farewell.